while you're here, your boss is en route to my district in Las Vegas, trying to rebrand the One Big Beautiful Bill. But back home, my constituents aren't buying what President Trump is trying to sell, because they're living the real-life consequences of higher cost, less certainty, and real fear about losing their coverage and their access to care. During the majority's field hearing in Las Vegas last year, they shut out the public and brought in a paid actor. I took a different approach. I invited my constituents to share their real stories about what these healthcare cuts would actually mean for them. And what I heard wasn't a matter of politics, but rather of survival. One of those constituents is Deja, a mother of a medically complex child, Shay. Shay was born at 30 weeks. He spent 3 months in the NICU and came home on an oxygen and feeding tube, one he still depends on to survive today. He needs in-home nursing, specialists, and ongoing care, all made possible by Medicaid. Without it, his family would face inaccessible costs and copays, leaving Shay at risk of failing to thrive. I've also heard from another constituent, Richard, who told me that at the beginning of this year, his marketplace premiums went up $1,700 a month. He said he and his wife are effectively out of the economy. They don't go out. They don't get to go to restaurants. There's no discretionary spending because they're just trying to make sure that he has access to care. So families like Deja's and Richard's, to them, the healthcare affordability crisis is real and it's urgent. So let me bring it back to the basics: cost and coverage. What are you doing right now, Mr. Secretary, to lower premiums and to protect coverage for families like Deja's and Richard's?
Well, first of all, I would say, Congressman, there are no cuts to Medicaid. You look at the
What are you doing, Mr. Secretary? That's my question. Is what are you doing right now? What are your priorities to reduce cost and ensure coverage for the American people?
Well, we negotiated the lowest drug prices in history. And we're implementing those now with the MFN. This is one of many things that we're.
And how does that address coverage?
Well, in terms of insurance coverage, we're doing many, many things within the agency. We are, President Trump is right now with his.
What are you doing? You're the Secretary of Health and Human Services. Reclaiming my time. I'm asking about tangible actions and results. To me, the fact that you can't answer a basic question like bringing down cost and coverage, which should be your top priority, not some podcast, but actually addressing the needs of people. Now, like others, I want to make America healthy. I agree with the goal of moving from a sick care system to a true health care system focused on prevention. And prevention starts with the basics: clean air, clean water, and reducing exposures to toxins. So I'm struggling to reconcile the reports that some at EPA are working to roll back protections that would increase exposure to heavy metals in drinking water, arsenic, lead, mercury, and chromium. These are toxins linked to cancer, to heart disease, to stroke, and permanent brain damage in children. So just one question: were you consulted on those efforts to roll back those EPA protections? Yes or no?
No, I haven't been, but I'm happy to talk to you right now about a long list of things that we're doing to roll back insurance premiums. And I would begin that with skin substitutes. Our reform on that is reducing premiums in Medicare by 6% this year.
Have you aligned your goals dealing with the reforms to the EPA protections and how that is making people sicker, not healthier? That was my question.
Yeah, I could not answer those questions because it's
you
not
can't
in
answer the question as the
Secretary.
Secretary.
It's not my agency.
You don't coordinate with the EPA, Mr. Secretary? Your department is not involved with rolling back protections that would increase exposure to heavy metals materials even though it affects people's health? Is that what you're telling me? You don't coordinate?
I say, calm down, Congressman.
Don't tell
And
me,
the
healthcare is
answer-
personal
Okay.
to my constituents like Deja
Your
and
time
Richard.
is over.
Do not tell me to calm down. Healthcare is real. And if you can't answer basic questions, then maybe come prepared next time.
I'm answering the question. You don't give me the chance to answer. You haven't given me a chance to
You
answer.
said you
I'm happy
didn't-
to answer your
you said
question.
you
And
weren't-
cut me off when I started to answer.
You said you
You started screaming
not
at
consult-
me.
Okay, the
with
time has
EPA.
expired. We're going to move on. Mr.
People
Yocum.
scream when they don't have much to say.
You obviously don't have anything to say because you can't even uphold what it is you're
Say it.
doing to
Mr.
reduce
Horsford,
cost
your 2
and
minutes
coverage.
over.
Give me a chance to answer the question.
Congressional oversight serves as the essential bridge between executive policy and the citizens it is designed to serve. On April 16, 2026, the House Ways and Means Committee convened to review the HHS fiscal year 2027 budget proposal, setting the stage for a high-stakes exchange between Representative Stephen Horsford and HHS Secretary Robert F. Kennedy Jr. To understand the 2026 legal and fiscal landscape, we must look past the rebranding efforts of the administration's One Big Beautiful Bill and focus on the tangible metrics of healthcare access, cost, coverage, and the public health impact of regulatory shifts. This hearing wasn't just about spreadsheets. It was about the fundamental survival of the most vulnerable members of society. A primary theme of this hearing was the affordability gap. Representative Horsford utilized the personal stories of his constituents in Las Vegas to challenge the administration's narrative. He highlighted the case of Deja, a mother of a medically complex child named Shay, who depends on Medicaid for life-saving home nursing and feeding tubes. The educational takeaway here is the Healthcare Sustainability Index. When premium increases, like the $1,700 monthly jump reported by another constituent, Richard, force families out of the economy, the system has fundamentally failed. Secretary Kennedy's defense focused on Most Favored Nation, MFN, drug pricing negotiations. While lowering drug costs is a vital pillar of health policy, the hearing exposed a functional decoupling in 2026 strategy. Lowering the price of a pill does little for a family that can no longer afford the insurance premiums required to access a doctor's prescription. For the viewer, the takeaway is the premium paradox. As of 2026, the administration claims no cuts to Medicaid, yet proposed budget shifts and efficiency reforms are viewed by critics as a de facto reduction in access for complex care patients. The discourse then pivoted to the environmental determinants of health, a cornerstone of the Make America Healthy Again or MAHA movement. Representative Horsford pressed the Secretary on a critical, often overlooked area of policy: the intersection of public health and EPA regulations. Reports in early 2026 suggested that the administration was working to roll back protections against heavy metals, including lead, arsenic, and mercury, in American drinking water. From an educational standpoint, this represents a conflict with the precautionary principle in governance. If an agency charged with health is not coordinating with environmental regulators whose actions contribute to cancer, heart disease, and permanent brain damage in children, the entire prevention-first strategy is logically undermined. The Secretary's admission that he had not been consulted on these rollbacks highlights a persistent silo effect in the 2026 federal bureaucracy. Critics argue that you cannot claim to focus on wellness while simultaneously increasing the population's exposure to known toxins linked to the very chronic diseases the HHS aims to eradicate. A particularly revealing portion of the hearing involved the institutional etiquette of accountability. The moment the Secretary instructed a member of Congress to calm down while discussing the life and death stakes of family health care ignited a firestorm of criticism. This serves as a vital lesson in legislative conduct and the moral authority of command. In the 2026 oversight era, the professionalism of a cabinet secretary is measured by their ability to remain centered when confronted with the real-life consequences of their policies. The exchange clarified that for many Americans, healthcare is not a podcast topic. It is a matter of survival that demands a matching level of urgency from leadership. Furthermore, we must consider the broader 2026 political context. Representative Horsford's aggressive stance comes at a time of significant transition in the House. Just days prior to this hearing, on April 14, 2026, fellow California Representative Eric Swalwell resigned from Congress following a series of personal and professional allegations. This shift in the Democratic caucus has placed increased pressure on leaders like Horsford to serve as the primary check on the Trump-Kennedy health agenda. The hearing effectively became a litmus test for the administration's ability to defend its trillion-dollar healthcare restructuring plan against charges that it prioritizes rebranding over results. The technical core of the debate also touched on Medicare reform and skin substitutes. Secretary Kennedy pointed to specific reforms in Medicare as a way to reduce premiums by 6%. From a legal and administrative perspective, this is an example of granular fiscal reform. However, the committee's skepticism suggests that these small-scale administrative wins are being overshadowed by the macro-level fear of losing foundational coverage. As we move through the 2026 budget cycle, the focus has shifted toward whether these tangible actions mentioned by the Secretary will actually manifest in the bank accounts of families like Dejas and Richards. In summary, the April 2026 House Ways and Means hearing reveals an administration grappling with the consistency of its MOHA mission. Whether it is debating the coordination between the HHS and the EPA or the refusal to acknowledge the human cost of rising premiums, every exchange is a lesson in how public health is managed in a divided government. These are not merely partisan talking points. They are the foundational questions regarding the state of the national health in the 21st century. By understanding the link between environmental toxin regulation, Medicaid expansion, and insurance marketplace stability, viewers gain a clearer view of the challenges that will define the American healthcare debate for the next generation.